Good morning, students. طلاب ثالث. I will start the lecture today, which is, of course, concerning mycology, which is entitled Cryptococcosis and Toruliosis, which is referred to as also Toruliosis. Of course, with the meaning of Toruliosis or Cryptococcosis, Toruliosis is mean yeast infection, types of yeast infection, because Cryptococcosis caused by one type of yeast-like infection localized Candida. Later on, let's see what are the details of the cryptococcosis. Cryptococcosis is an infection caused
دكتور
by...
أزهار العفو.
نعم.
دكتور عندنا محاضرة بس وبعد ما خلصت هي حيخلص مع دقيقتين.
اوكي مو اشكال، بس اعطيني خبر اذا ما صار زحمه عليك من تخلصون ان شاء الله.
إن شاء الله دكتورة.
شكرا ممنونه.
عفو.
طلاب اني صار 9:15، هاي مو مشكلتي. طلاب الو طلاب. I'll start the lecture, okay, which is entitled Cryptococcosis, referred to as also Toruliosis. Toruliosis is mean yeast infection. Because Cryptococcosis is a type of yeast infection just like
دكتورة هي خلص.
دكتورة
دكتورة شكرا آسف على الإزعاج.
لا بالعكس. Okay, let us know of course, put in your mind today we'll speak about two types of diseases caused by fungi. Okay, because of course I obliged to compact my lectures because I have no time in the future. Now, cryptococcosis, what is the meaning of cryptococcosis? It means it's an infection caused by fungus, Cryptococcus neoformis. The genus, just one genus, one species, Cryptococcus neoformis, which is mainly encapsulated. That means it's surrounded by capsule. The infection is, of course, put in your mind, or I want to remind you, this is a definition of the disease. Infection is initiated by inhalation of the microorganism into the lung. That means the major site when they inhaled by the individuals, I mean of the fungi, go to the lungs, but it has a remarkable propensity toward to disseminate hematogenously to brain and meninges. That means the major disease caused by Cryptococcus is meningitis. Of course, we will know the details. Cryptococcosis is considered to be the fourth most commonly recognized cause of. انتبهوا على هذا definition. Cryptococcosis is the fourth most commonly recognized cause of life-threatening infection among AIDS patients. About a third of these patients, of AIDS patients
دكتور
should.
العفو بس ممكن تقلبين السلايد؟
نعم عينيش بي
باقي على الأول.
لا حركته أنا عندي محرك. دقيقة ثانية عندي دا أشوفه. هسه هذا ثاني واحد صح؟ نشوفه؟
لا دكتور الأول ما أعرف، أخاف إنه ضعيف، يجوز احتمال من المشكلة.
إيه لأن أنا دا يمشي يمي.
لا يمي دكتور.
تمام.
أكو أحد من زملائك دا يشوف؟ أكو مشكلة؟
دكتور هم يقولون نفس الشيء. جعفر يقول.
يعني دقيقة واحدة خلي أرجع أجسم أنا. مشكلة
دكتور هيك تمام.
دكتور هسه تمامي.
أوكي.
نعم دكتور شكرا.
إذا أكو problem please just inform me. هسه نرجع. أوكي. Now, cryptococcosis is okay now?
نعم دكتور.
نعم.
Okay. Cryptococcosis is considered to be the fourth most commonly recognized cause of life-threatening infection among AIDS patients. Third of AIDS patients should develop cryptococcosis. Sometimes the cryptococcosis is considered to be the definition of AIDS. That means third of patients should be okay infected with the cryptococcosis. Cryptococcosis occur in about more than 50% of the total cryptococcosis cases reported annually in US are from AIDS patients. This is just مجرد يعني خلينا نقول إحصائيات يعني data collection. Now, according to the Center for Disease Control National Surveillance, which is referred to as CDC-NS, data published in 1988. Why in this period of time? You know, the flare-up of AIDS starts in approximately 1980, 88, in this period of time. Cryptococcosis or Cryptococcus meningitis is most prevalent among AIDS patients. But whom those AIDS patients? Not all patients. Why we said third of AIDS patients may develop this disease. Some of those entities, third of patients of AIDS patients develop cryptococcosis.
دكتور العفو نفس المشكلة.
شنو القصة؟
دكتور لا تكبر السلايد يعني ايه هسه ايه تمام.
اوكي هو بالعكس على مودكم يعني اوكي.
دكتور مو ما يقلب السلايد انا على مود هاي المشكلة. شكرا دكتور.
اوكي صحيح. Okay, أزين. Who those entities of AIDS patients develop cryptococcosis? That means not all AIDS patients develop cryptococcosis, just a special entity whom IV drug users, Haitians, دول الهايتيين في الجروب race يعني black race. Those are more prone to develop cryptococcosis. I mean AIDS patients. دول IV Haitian blacks AIDS patients. Epidemiological studies conducted prior to the AIDS epidemic indicated that the infection caused by the variety طبعا هنا أنا قلت لكم بالبداية and just one genus, one species, Cryptococcus neoformis, okay, but this species consists of two varieties, يعني subspecies, okay. Varieties, the first one, neoformis, that means we have Cryptococcus neoformis, the same variety, the same species, okay, which is worldwide distributed, causing the disease, I mean cryptococcosis. While the other variety, يعني Cryptococcus neoformis, GAT-T, نسميه GAT-T, Cryptococcus neoformans GAT-T. This is prevalent only in tropical and subtropical regions. That means neoformans it's worldwide distributed, while neoformans GAT-T just in tropical and subtropical regions. Now, concerning clinical manifestations, you remember I said in the beginning the site of entry or portal of entry of fungi, Cryptococcus mainly is the lung, but it has a propensity toward hematogenously go through blood and inside home meningeal membrane, causing meningoencephalitis. The major disease caused by Cryptococcus is meningoencephalitis. Of course, what's the meaning of meningoencephalitis? That means infection of the brain and meninges, which is responsible of the death. Of course, it's a very serious disease because the patients, unless it's treated, of course, he will be deteriorated and die. The symptoms depend on the, of course, rapidity of the onset. The indolent cases note what are the symptoms that the patient develop in case of meningoencephalitis. Of course, headache, which is this headache initially relieved by analgesic, okay, but the pain return because the agent is still present, okay. Now the pain is dull bilateral, dull يعني painful, and bilateral, sometimes diffuse, okay. The other symptoms associated with the headache are, of course, you know, meningoencephalitis is a complex of manifestations. In addition to headache, nausea, dizziness, irritability, decreased comprehension, impaired memory, and get ataxia. These are the most important symptoms that associated with cryptococcus, meningoencephalitis. Sorry. Can you see here this picture? Okay, these foci, if you can see here, this is CT scan of the brain of patients. Okay, you can see these foci of cryptococcosis that infect the brain. Of course, in addition to the previous symptoms, the patients maybe develop further symptoms. Of course, if he not treated, changing in personality and mental acuity, that the family member said he is abnormal, but he said I'm normal, okay. The infection, when it's progressed within the time, other symptoms may be flare up. What are these symptoms? Lassitude. What's the meaning of lassitude? يعني هاي تشوفونه ما يقدر يفتحها مع الواحد منعس. Lassitude, blurred vision. You know, if you don't know any term, please just ask me. Blurred vision, double vision. Also, you can see blind spot, which is scotoma in the visual field. In addition to these are the most important symptoms of meningoencephalitis. The onset of coma may be sudden, sometimes accompanied by respiratory arrest, and this is a disaster here. Fever is often low grade or sometimes absent until late in the course of infection. Sorry, the patients may deteriorate and die within as little as 2 weeks of the onset of the symptoms. Of course, unless he is treated. It's so serious disease. You can see this is a gross section of brain of autopsy patient. طبعا our patient was developed cryptococcosis. طبعا تشوفون هاي الفوساي كلها فوساي. هاي شنو هي هاي؟ طبعا characteristic feature شو يسمون definition of the brain of patients with the cryptococcosis is look like Swiss cheese like brain section. يشبه الجبن السويسري المنقط مزرف. Okay, this is the characteristic feature of meningoencephalitis caused by cryptococcosis. Now, the other disease, we cover almost the important manifestations of meningoencephalitis. The other second disease caused by cryptococcus is pneumonia. Okay, pulmonary cryptococcosis has many manifestations. Of course, some patients have pre-existent lung disease. Those patients with a pre-existent lung disease superimposed by Cryptococcus neoformans. And that means Cryptococcus neoformans alone not cause pneumonia unless the patient suffering from pre-existent lung diseases. Okay, Some patients develop self-limitation, okay, improvement, pneumonia without treatment. The onset, this is if he is immunocompetent, of course, patient. The onset is indolent symptoms, and the symptoms present in only half of the cases. يعني half of the cases asymptomatic, and the other half are symptomatic. What are these symptoms? Dry cough, dull chest pain, and little or no fever. These are the most important, which is not a specific pneumonia. The central cavitation is found occasionally, and this is very important, but calcification is rare in case of pneumonia due to cryptococcus. You can see this is, okay, this the cryptococcosis, I mean the colonization of the upper lobe of the lung. This is another. This is cavitary lung disease due to cryptococcus. Yes, cavitary. This is the cavitary lung disease. Now, the other disease caused by cryptococcus is skin lesion. Skin lesion. This is not come as active infection. How it's come? From hematogenous dissemination. You remember in the beginning I said when the microorganism inhaled by mouth and go to the lung, by blood stream, the microorganism incede whom? Meninges and the brain. But it's also sometimes not just for brain and meninges. If the patient is debilitated, immune compromised, it's also incede other parts, just like skin, causing skin lesions. Approximately 10% of patients with cryptococcosis may develop this phenomenon. The lesion starts as what? It starts as a small, painless papule. It starts as a small, painless papule. As a lesion becomes, which within the time it's increased in size, becomes a few centimeters in diameter. The center often becomes shiny and flat. The center becomes, this is characteristic feature of the lesion caused by cryptococcus, is shiny and flat. With further progression, the center becomes depressed, and usually ulcerated and draining exudate that contains numerous cryptococci. This is the characteristic feature of the cutaneous lesion caused by hematogenous disseminated cryptococcosis. As you see here, this is multi lesion on the skin. شوفوا هاي هنا flat and shiny. إذا تشوفون هاي وحدة، هاي بعدهم بادية maybe. Okay. And this is AIDS patient develop multi skin lesion on her face. This is another picture, I think the same patient, okay, with multi-cutaneous due to cutaneous cryptococcus lesion in AIDS patients. Now, the fourth disease is the bone and joint involvement. Bone and joint involvement. Of course, this is come from of course joint involvement. This also involve vertebrae, ribs, skull, even the skull infection. Of course, meningoencephalitis may be reach skull. A bone may be reach vertebrae, ribs, joints, whatever. Of course, this entity, I mean fourth point, in bone and joints, come from hematogenous dissemination, of course. Fifth one, eye lesion. Eye lesion also come from the hematogenous dissemination, which is causing the phenomenon chorioretinitis. The other disease is caused by cryptococcus when it's disseminated hematogenously, causing pyelonephritis, maybe cause prostatitis, may cause endocarditis or hepatitis, sinusitis, and even esophagitis. Complications. This is, of course, when it's spread hematogenously. Concerning differential diagnosis, how we discriminate meningoencephalitis from, caused by cryptococcus from other diseases, which is mimic to the picture of meningoencephalitis caused by cryptococcus. The term meningoencephalitis meningitis can easily create the mistaken, meningoencephalitis caused by cryptococcus, mistake impression that the infection mimics aseptic meningitis. Aseptic meningitis, you know, that's the meningitis caused without any causative agent, okay? But the truth is quite the contrary. More common diagnostic confusion being brain tumor. That's mean meningococcal meningitis may sometimes confuse with not aseptic meningitis, but confused with a brain tumor. This is the fact. In patients with AIDS, a focal lesion on CT scan, of course, CT scan is mean. Okay, the clinical picture, it's mimic another disease. Of course, I still speak about the cryptococcus meningoencephalitis. This is mimic toxoplasmosis because toxoplasma it's a type of parasitic disease. طبعا ان شاء الله بالكورس الثاني تاخذون الباراسيتولوجي. parasitic disease اللي هو بالعربي نسميه داء القطط، اكيد بتسمعين به. اوكي. Mimic toxoplasmosis. Toxoplasma have a predilection in AIDS patient in particular, go to the brain, causing and meningeal membrane, causing also meningoencephalitis. Therefore, in AIDS patient, sometimes there is a confusion. I mean, meningoencephalitis in AIDS patients confused if it is belong cryptococcus or toxoplasmosis because there is a similarity. Okay. Sometimes even confused with meningitis due to Mycobacterium tuberculosis. Mycobacterium tuberculosis also cause meningitis in AIDS patients. This is also another entity may be confused with meningoencephalitis caused by cryptococcus. Now, pulmonary cryptococcosis, this is not distinctive clinically. You remember I said pneumonia, it's not a specific, dry cough, dull chest pain, cough, whatever, cavitation. This is not a specific, maybe confused with other types of pneumonia, okay? In particular, when we can see discrete lesions in chest x-ray, okay? This is also, if the patients develop multiple lesions in chest x-rays and there is no fever. You remember some, I said in pneumonia, I said some patients febrile, some of them not febrile. So if the patients afebrile, this is maybe confused with neoplasmic disease of the lung. Cryptococcus are scanty in the sputum, okay? Even there is infection. We cannot isolate this microorganism easily from the sputum because it's found scanty number, يعني قليل. Except in patients with cavitary lung disease. Here we can isolate huge number of cryptococcosis from the sputum. Concerning treatment, near all patients with a cryptococcal infection require chemotherapy. When I said chemotherapy, مو قصدي chemotherapy طبعا هذا أبو الكيميك أو الكانسر patient. No, chemotherapy it's mean antifungal chemotherapy or it's a special antifungal chemotherapy. Not all types of antifungals. Chemotherapy to prevent progression to death of cause. In untreated Cryptococcus meningoencephalitis, this is maybe fatal. You remember I said as little as within 2 weeks of the onset of the symptoms. Maybe the patients die or some patients not die, still suffering from Cryptococcus meningoencephalitis, but the symptoms are not severe. Okay, just look like chronic symptoms, still up to 13 years. The best documented instance of spontaneous resolution or cure, the surgical excision have occurred in Cryptococcus confined to the lung. Of course, surgical excision maybe have a role in case of pneumonia or pneumococcal pneumonia, and by lobotomy, of course, this is the drug of treatment of choice in such patients. Drainage of large soft tissue abscesses. You remember I said some joints, bones, vertebrae may be involved. In case of such cases, I mean, the drainage of soft tissue abscesses may be beneficial for treatment of such entities. The regimen of amphotericin B plus flowcytosine. هذا الفلوسيتوسين it is chemotherapy. This is referred to as chemotherapy. Okay. Amphotericin B is antifungal, very good drug. Amphotericin B is the plus flowcytosine have good results in some patients when given for only 6 weeks. Well, although it's considered to be long period of time, but it's maybe beneficial in such entities of patients. I mean, developing these bone lesions or pneumonia or whatever. Now, lab diagnosis. How we can diagnose cryptococcosis? Of course, diagnosis depends on the site of infection, the symptoms the patient is suffering from. The characteristic feature of Cryptococcus neoformis, it's look like oval or lemon-shaped cells, because it's yeast, look like candida. Okay, it's oval, lemon-shaped. Okay, or sometimes globus, مدورة. and it is capsulated or encapsulated بالE يعني encapsulated capsulated. Okay, the capsule formed from polysaccharides. The capsule can be detected readily when cells are mounted on pigmented colloidal mounted fluid. What is the name of this pigment used for staining of this microorganism to see the cryptococcus? It is the Indian ink. نسميها Indian ink or nigrosin. طبعا هنا شلون يكون الدايجنوسيس؟ of course, for example, patients suffering from meningoencephalitis. Okay, you know meningitis method, for example. We take the CSF volume, of course, depend on the age of patients. If he is adult, if he is child, if the patient child, of course, the volume so small, 0.5 maybe up to 1 ml. In adults, maybe reach up to 10 ml. We can take more amount of the CSF in adults, of course. Here, in case of children, because it's so small volume, we should not centrifuge the sample. Put in your mind, centrifugation is better than none. Why? To sediment the microorganism. But in case of children, meningitis, CSF volume is so small. In order to not lose any drop of CSF, you should not centrifuge the sample. Okay, just take it as intact sample. In case of adult, no, should be centrifuged because it's enough amount. Okay, from the sediment of the CSF or from the intact in children, the CSF, we take drop, okay, put it on a slide and stain with Indian ink. Okay, the Indian ink, as I mentioned previously, Indian ink or nigrosin, this stain is a special stain. It is negatively charged stain. It is negatively charged stain. The capsule of Cryptococcus is also negatively charged. Therefore, when we stain with Indian ink, negative, there is repulsion, no penetration, of course, okay? Therefore, we can see black background because Indian ink is black in color, okay? Black background against shiny dots. تتبين لماعية لأنه cannot be stained لأن قلنا هي negative stain، okay؟ هاي negative يصير repulsion تنافر. We can see this is the picture of a positive slide of negative stain. I mean Indian ink. هاي طبعا نفس الكومنت اللي حكيته قبل شويه. طبعا of course this is concerning من أصبغه طبعا بالإنديان ink. This is considered to be direct stain in case of culture. How we cultivate the sample. Of course, we take the sediment of CSF or intact in children case, can spread it on the subrot agar. The media can be used for this purpose. I mean for the isolation of the microorganism, and incubated at 30 to 35 degrees centigrade for 2 up to 3 days only. These are the most important circumstances should be available for the microorganism in order to obtain the good growth of Cryptococcus. هاي طبعا different pictures of هاي طبعا تشوفوها الكبسول وهاي section, I think lung section. هاي الكبسول, this is the microorganism. This is you can see here, this is the microorganism and this is the capsule. Clear enough, okay? This is different pictures of different patients with this is Cryptococcus by scanning electron microscopy. This is very nice picture. You can see, as I mentioned previously, I said it is yeast-like fungi, okay? So you can see this is the daughter cell and this is the mother cell. So there's a detachment here in this area. The daughter cell detached from the mother cell. It is yeast. Of course, this is the neck of the detached area. This is the, of course, because it's propagated by budding mechanism. This is another picture, we saw it previously. This is transmission electron microscopy. This is, you can see here, it's elongated Cryptococcus. طبعا it has simple hyphae, okay? Not mold, not look like mold. It's simple, tiny hyphae which is attached to the yeast. طبعا this is a picture of patients having 8 patients with mucocutaneous cryptococcosis. This is just look like thrush, if you remember, thrush of candida. This is 8 patients developed cutaneous. Okay, these are we covered cryptococcosis. I jump to the other disease, which is sporotrichosis. I don't know if there is anybody here or not. طلاب هنا اكو احد؟
نعم دكتور موجودين.
عاشتك. Okay, now we go to other disease, which is the sporotrichosis. طبعا you remember I said you will hear strange names, okay? But in future, inshallah, you will when you enter the medical field, you can see different. This is will become familiar for you. Now, sporotrichosis. Sporotrichosis. It's another disease caused by another fungal agent. Also, the disease referred to us, طبعا أحط between two brackets, that mean this is the synonym of the disease. These are the synonym. قبل شوية قلت cryptococcosis, which is referred to as torullosis. This is the synonym of sporotrichosis. It's Rose Gardner's disease. Why it's referred to as Rose Gardner's disease? Because this microorganism, Sporothrix, responsible for sporotrichosis, contaminate the thorns السلاية of rose. هاي السلاية مالت الوردة. فمن يجي الجارنرز maybe injured his finger, whatever, okay, by this splinter or a thorn, and it's contaminated already with this microorganism, the disease will be occurred, okay? Because it's famous as Rose Gardner's disease, referred to as this disease, or it's referred to as also rose thorn disease. Thorn يعني السلاية مثل ما قلت لكم. Thorn splinter is the name disease. The same name. This is the definition. What is this sporotrichosis? It is a chronic infection, usually limited to the cutaneous and subcutaneous tissue. معنا نشوف هنجي cutaneous and subcutaneous, not cutaneous only, not subcutaneous only. Okay, it's called cutaneous and subcutaneous disease. Although it may become disseminated, that means it's responsible for wide range of symptoms, cutaneous, subcutaneous, and disseminated. Okay. The lesions of the cutaneous form of the disease develop where the positive agent. شو اسمه positive agent? طبعا the disease قلنا sporotrichosis, but the causative agent referred to as sporothrix, TH, not T. Sporothrix schenkii is just one causative agent, just one genus, one species. Sporothrix schenkii, only one fungi responsible for sporotrichosis, which it's introduced to the site of skin injury and the lesion appear at what is the characteristic feature of the lesion when it's occurred, developed, I mean. It is erythematous, ulcerated, or verrucous nodules. The lesion either erythematous or ulcerated or sometimes verrucous. شنو يعني verrucous؟ verrucous is mean in Arabic ثؤللي. هذا الدرماتولوجي ان شاء الله تاخذون هذا المصطلح حيمشي وياكم هوايه. verrucous is mean ثؤللي. شلون فالول نسميه؟ اوكي؟ ثؤللي. verrucous. ulcerated واضح. erythematous I think it's clear. Now, with the disease, in addition to the cutaneous and subcutaneous manifestations, subsequent nodular lymphangitis or lymphangitic spread may be accompanied this disease. The characteristic feature of sporotrichosis, not restricted in cutaneous and subcutaneous, but it's also may be spread to where? To the lymph nodes, okay, through lymphatic canals. The pulmonary sporotrichosis presumably results from the inhalation of the fungus. That means we have another type of disease, either from injury, trauma, contact with the source of infection, cutaneous form, and subcutaneous form, sometimes pulmonary sporotrichosis by inhalation of the spores produced by this fungi, but this is rare in comparison with cutaneous and subcutaneous. The infection may also be hematogenous disseminated. You remember said in the first paragraph, I said it may become disseminated. Hematogenous dissemination may be occurred. Of course, put in your mind, hematogenous dissemination mainly occurred in immune-compromised patients, although some entities of immune-competent develop a hematogenous dissemination. But almost, of course, immune-compromised. Hematogenous dissemination may be occurred, of course, and which is involved any part of the body, bones, joints, skin, eyes, CNS, and even gut. Now, of course, as I mentioned previously, just a causative agent. One causative agent is Sporothrix schenkii. But put in your mind, this microorganism is dimorphic. Why dimorphic? Because it has two forms. Two forms, you remember, I said in the beginning, I can't remember, first lecture or second, whatever. Okay, I think first lecture, I said the dimorphic, that means it has two forms of, the yeasty form and moldy form. We have, of course, in general, either yeast or mold. But some fungi just look like Sporothrix I have, it is dimorphic. That means it's yeast and mold. Where it's become yeast and where it become moldy form. When it's entered inside the human body, it's become yeasty form. It's become yeasty. When it's outside the body, it's become moldy form. Okay, this is the forms of Sporothrix Schenckii. Concerning clinical manifestations, of course, the first entity or major entity caused by this agent is cutaneous infection. Disease arising at the site of minor trauma. If you remember, I said minor trauma cause contact with the source of infection and forming small erythematous papule. Okay, small in the beginning, of course, small erythematous papule that enlarge within the time, within days, within weeks. Sometimes is discharging small amount of glary pus. What's the meaning of glary? Glary is mean lamma, shiny. Glary pus, but remaining relatively painless. The characteristic feature of the lesion, it is painless. Okay, painless lesions. Therefore, sometimes it's neglected by the patients and may be complicated. No systemic, of course, complication associated with the disease. Although the lesion may remain single, particularly on the face of children, may remain single. Sometimes no, even on the face of children, multiple lesions. But in general, it's single on the face of children. There is a marked tendency to produce subsequent discrete nodular lesions spreading to proximal size because of spread along lymphangitic channels. شوفوا هنا طبعا if you remember I said in the beginning through lymphatic channels the microorganisms have the ability to spread, okay, and in addition to the primary lesion, the secondary lesion will tertiary lesion, other further regions may be developed from the lymphatic channels seeding the skin again. You can see this is a type of lesion. طبعا this is ulcerative type. احنا قلنا بالبداية either erythematous, ulcerative or verrucous. This is ulcerative type of lesions. This is verrucous طبعا هنا وهذا طبعا تشوفون الفيس. احنا قلنا although it's one single on the face, but some patients may develop multiple lesions, even children. Okay, because this area is rich with lymph nodes. شوفون هنا multiple lesion. Although it's come from injury, single side, okay, single side, traumatic, causing the symptoms, but through lymphatic channels, the disease spread here and there, causing scatter lesions. This is another type of ulcerative lesion caused by Cryptococcus, and cutaneous, of course. This is verrucous type. This is verrucous type of Cryptococcus skin lesion. This is also verrucous type. This is more severe verrucous type. Okay. Here, these lesions are commonly described as, what is the name of these lesions? Not the single lesion, but when it's disseminated through lymphatic channels, it's referred to as lymphocutaneous because it's lymphatic and cutaneous. Lymphocutaneous, or it's referred to as cutaneous lymphatic sporadicosis. They are occurred on the skin and the lymph nodes. The secondary lesions, in addition to the primary and secondary due to the involvement of the lymph nodes, produced along the lymphangitic channels follow much the same indolent course as the primary lesions. That means the secondary lesion, it's also indolent, يعني asymptomatic, okay? Just look like the primary lesion. This area, you know, neck is very rich with lymph nodes. This is طبعا you can see this is the area, the source of infection. Trauma may be exposed to the source of infection causing the symptoms, and these are the other subcutaneous swelling. You can see, طبعا, of course, this is, unless it's treated, in future will be opened, just look like this to the skin. Now, larger lesions, larger lesions in any site may become violaceous and ulcerate in the center. What's the meaning of violaceous? يعني يصير لونها بنفسجي, violaceous and ulcerated in the center. This is the larger lesion within the time. These nodules, small papules nodules, may be large and violaceous, become and ulcerated. There are cases in which a single cutaneous lesion appears. You remember I said sometimes on the face, and particularly of babies, just single lesions. Sorry, single lesions only maybe appears, okay, and this is without spreading through lymphangitic channels and become chronic, although it's single, become chronic, and this is referred to as plaque or fix مبين. plaque. what's the meaning of plaque? plaque in Arabic لو نترجمه هو البروش يعني بروش، هذا البروش الدنبوس بيحطوا الفينيلز بالسترة. ليش plaque? because the plaque is different from the surrounding textile، القماش اللي داير مداره، فبلاك فشيء مميز، اوكي، فجت البلاك من هذا الاسم، اوكي. plaque or fixed lesion. Skin lesions may also result from hematogenous dissemination. This is another point, and not just from trauma, active infection also. It's come from hematogenous dissemination, just look like cryptococcosis. Hematogenous dissemination, and this is when we can see several scattered lesions. This is an area maybe not rich with lymph nodes. This is maybe comes from hematogenous dissemination. هنا طبعا في الكيس حلوة. شلون اريد اشيل هذا وشلون اعاين الحكي اللي هنا. اي اوكي. هاي فد كيس in India في المنطقة اسمها مهاراشترا، ما ادري شنو بالباكستان I think. Okay, this is the case in the case report. 26 years old male resident in Kolhapur ما ادري شو اسمه في المنطقة باكستان presented with a plaque. شوفوا plaque, just one single area. plaque, شوفوا plaque because it's different from here and there. Okay, there, sorry. A plaque area on the posterior aspects of the left ankle for 6 months duration. ظلت plaque fixed without spreading for 6 months. Okay. It was clinically diagnosed طبعا هي هاي وبعدين صار هذا spreading after 6 months. Okay. It was clinically diagnosed in the beginning as a borderline tuberculoid leprosy. You know the leprosy? أخذتوا الميكوبكتيريوم leprosy؟ لا؟
نعم دكتور أخذناها.
أخذتوها؟ أوكي، فعندنا different types of leprotic leprosy، tuberculoid، أكو border ما أدري شو يسمون line، يعني تقريبا more than 5 types of leprosy. Okay. ف in the beginning the clinician diagnosed this phenomena as borderline tuberculoid leprosy, okay, who later developed few nodules for 6 months, developed later, okay, بتشوفوها هذه ulcerative nodules in linear fashion on his left leg, which ruptured to form non-healing ulcer, okay. Therefore, من صار طبعا هاي dissemination and scattering lesions, the orientation of the clinician here toward another disease. It is not tuberculoid leprosy, of course. We should cultivate the area, sorry, the lesion to know the causative agent. When they cultivate the sample, طبعا they take swab from the pus of the lesion, cultivated, they saw the causative agent, I mean the fungi, Sporothrix shanki. Of course, the patients were successfully treated with oral potassium iodide. The potassium iodide is very, very beneficial in such phenomena. Now, pulmonary sporticosis. Pulmonary, this is another disease. Of course, inhalation of the spores. احنا قلنا outside the body, it's moldiform. That means it's spores. While when it's enter the body, human body, it's become a yeasty form. Okay. The inhaled spores may be developed pulmonary sporticosis. The predominancy of male to female, I mean a ratio of infection, male to female is 6 to 1. 6 to 1 female. That's why, because the outdoor activity, of course, particularly those farmers, okay, may be exposed to these spores. Therefore, the percentage of such infection is higher than female. With an average of 46 years, they found that the average active age of infection 46 years. The symptoms are cough, low-grade fever, weight loss, and upper lobe lesions, which is not specific, of course. Hemoptysis sometimes occurred in 18%, and hemoptysis is very serious, you know. Okay, 18%, it's not low percentage. and it's maybe massive and fatal, of course, unless it's treated. Cavitation also, it may be seen. Of course, cavitation here leads to hemoptysis. Extensive fibrosis, the other symptoms, which are the fibrosis, pleural effusion, high laryngopathy, calcification, are rare in comparison with other pulmonary diseases. Now, you can see this is also cavitary lung disease due to sporothrix. Cavitary lung disease due to sporothrix. Okay. Now, osteoarticular sporococcosis. The other disease caused by this agent is osteoarticular sporococcosis. The majority of patients in this category presents with indolent. Well, put in your mind that almost fungal diseases are indolent, يعني asymptomatic, or symptoms just very little or faint in comparison with other diseases. Indolent onset of stiffness, start as stiffness, and within the time pain in the large joints. Okay, stiffness and then pain in the large joints. Radiological evidence of osteomyelitis, of course. When I said osteoarticular sporococcosis or osteomyelitis, it's here referred to as osteomyelitis, develops slowly with as appearance of moth-eaten. Moth-eaten, if you remember, the mycetoma, terminal actinomycetoma is moth-eaten appearance. Okay, moth-eaten appearance, or either moth-eaten or patchy lesions. Moth-eaten because it's small lesions, while patchy, it's larger. Patchy lesions that are difficult to distinguish from other type of osteolysis. Almost all cases of arthritis involve major peripheral joints. The major joints, of course, may be involved: knee, elbow, ankle, wrist, and big joints. Okay. Although fever may be present early in the illness, fever may be early in the illness, maybe occurred, sorry. But most patients still are febrile and have only maybe sometimes one infected joints, okay, joints, not multiple joints. Some of them multiple, some of them. This is, of course, depends on the immune response of the patients. In untreated patients, additional joints may be involved. Additional joints, untreated patients, sorry. Additional joints may be involved. The skins also may be involved, and particularly over the infected joints, okay? From the joints, open soft tissues over and open to the skin, mainly, okay? Because the skin may be appeared erythematous. I mean, this area which is covered over the infected joints may be erythematous and maybe develop drainage or draining sinuses. Sometimes destruction of the joints, cartilage, not involvement of the joints, of course, when it's involved. Sometimes destruction of the joint, cartilage may be continuous until all the mobility of the joints will be lost. Other forms of hematogenous sporococcosis. We have other types of sporococcosis where patients maybe develop hematogenous sometimes. Sometimes multiple skin lesions from hematogenous without involvement of other organs, just the skin. Okay. Some of them develop lung infection, some of them osteomyelitis, sometimes endophthalmitis also maybe occurs. Okay, or a few patients either also presented the brain abscesses or chronic meningitis and brain abscesses. Meningitis indolent also, just look like a chronic case associated with elevated CSF protein. The picture of sporothrix that infect or cause meningitis, the picture of CSF, the protein high level in CSF, and variable or absent mononuclear cells. Now, hydrocephaly is one of the complications of the severe cases, hydrocephaly of those due to chronic meningitis, neglection of the patients. Of course, this is lead to hydrocephaly. Of course, put in your mind immune-compromised patients, the considered to be the major entity that develop hematogenous dissemination, but put in your mind immune-competent also may develop hematogenous dissemination. Concerning differential diagnosis, of course, overlapping of the clinical syndromes may be occurred. This is need, of course, lab diagnosis to exclude inflammation case report قبل شوية طبعا suspected leprosy, but it is later on after culture they found that there is another causative agent. Okay, but diagnosis is very important, play a key role in the diagnosis of the protozoitic agents, while cutaneous porotrichosis has the most distinctive clinical presentation. A number of entities can mimic cutaneous porotrichosis. In addition, cutaneous porotrichosis may be mimic another disease. For example, cutaneous leishmaniasis. Cutaneous leishmaniasis اللي حبة بغداد, okay, maybe mimic cutaneous porotrichosis. Also, there is another disease, nocardia brasiliensis. طبعا nocardia brasiliensis, we have it in the previous lecture in mycetoma, and are responsible for actinomycetoma. Nocardia brasiliensis cause what is called sporotrichoid. Why it's referred من نقول يعني trichoid, that means it's mimic, look like, okay? بنسميها sporotrichoid because it look like sporotrichosis, okay? Lesion caused cutaneous lesion by nocardia brasiliensis is referred to as porotrichoid, and it cannot be distinguished from the cutaneous lesion caused by sporothrix. Mycobacteria also can cause chronic single lesion. Sometimes mycobacteria, حتى mycobacteria are responsible for tuberculosis, okay, TB, but it's also may cause chronic single lesions without spreading, okay, through the lymphatic channels, such as Mycobacterium leprae. And what are these causative agents of this tuberculosis? It is the Mycobacterium leprae, Mycobacterium cheiloni. These are another types of Mycobacterium. Maybe cause skin lesion, mimic the, in particularly the single lesion of a sporothrix or sporotrichosis, which is referred to as tuberculosis vericosa acutis. This is a type of dermatology disease. طبعا also it's caused by Mycobacterium, either leprae or cheiloni. These causing this, cheiloni and leprae causing another single lesions, or tuberculosis vericosa acutis is caused by Mycobacterium tuberculosis. The plaque, you remember plaque, we said plaque, it means fixed sporotrichosis. This is resemble leprosy, plaque sporotrichosis, as the case report we saw it previously. Resemble leprosy. Also, it resembles sometimes another disease which is referred to as chromoblastomycosis. Chromoblastomycosis is another fungal disease. Or foreign body granuloma. Foreign body granuloma, هاي الجرانيلوما اللي طبعا خلينا نقول فتشي foreign body يدخل للسكن ويسوي granuloma. This is foreign body granuloma. Or Majushi's granuloma, if you remember Majushi's, اللي أخذناها طبعا بالdermatophytosis, which is caused by in case of tinea capitis, Majushi's granuloma, or in chronic staphylococcus erythema. Also, maybe all these entities may be confused with plaque sporotrichosis. Now, lesions on the face may be mistaken with blastomycosis. Blastomycosis is another fungal disease. هذا إن شاء الله ناخذه في بالمستقبل إن شاء الله in the future. Blastomycosis, or it's also sometimes in face, in particular leishmaniasis, حبة بغداد أيضا نرجع, okay, or cat scratch disease. هذا اللي بيزونه من الشرمخ طبعا أكو فد bacteria causing this symptoms, okay, look like these lesions on the face. Cat scratch disease. Sometimes keratitis caused by sporothrix schincki, which is resemble any mycotic keratitis. Mycotic keratitis, يعني any keratitis caused by any fungi. But keratitis by sporothrix schincki confused with any mycotic keratitis. Conjunctivitis from sporotrichosis, while although it is rare, conjunctivitis, sometimes sporothrix causing also conjunctivitis, although it is rare, but sometimes maybe accompanied with enlargement of pre-auricular nodes, المنطقة اللي منطقة الإذن، okay, اللي خلف الإذن, okay, هاي المنطقة enlarged, okay, lymph node, and this is so-called oculoglandular syndrome. This is referred to as oculoglandular syndrome. This oculoglandular syndrome, this is stick for sporotrichosis. Conjunctivitis, sporotrichosis, associated, يعني when you say conjunctivitis, this is mainly accompanied with enlargement of pre-auricular node, This phenomena referred to as oculoglandular syndrome, and this syndrome confused with calcific disease because calcific disease also causing pre-auricular nodule enlargement, or also may be confused with adenovirus. Adenovirus, a type of virus, sometimes affect lymph nodes in this area. I mean, pre-auricular and causing enlargement of this area. Pulmonary sporticosis sometimes confused with chronic pulmonary histoplasmosis. Histoplasmosis ان شاء الله بالمحاضره الجايه ناخذها. It's a type of fungal disease. Pulmonary sporticosis just mimic pulmonary chronic فقط because histoplasma responsible for many entities, acute, chronic, whatever, capillary. Okay, just mimic chronic pulmonary histoplasmosis, also mimic tuberculosis. I mean, pulmonary sporticosis maybe mimic tuberculosis. Patients with septic pulmonary emboli, may have capillary infiltrate that are similar to that of sporticosis. Patient and the pulmonary emboli due to, for example, any causative agents. This is maybe mimic the pulmonary sporticosis. Osteoarthritis. That means in joints and bones. Osteoarthritis, also caused, of course, by sporothrix, can mimic or coexist. Mimic or coexist, either تشبه or found with osteoarticular sporticosis. Osteoarthritis ال OA نسميها يعني osteoarthritis not by sporothrix. osteoarthritis لأن أكو سامعين سوفان، هذا السوفان okay sometimes mimic as symptoms or coexist with osteoarticular sporticosis. So rheumatoid also is confused with rheumatoid arthritis. Okay, the distinction of sporotrichoid tenosynovitis. There is a sporotrichoid tenosynovitis from carpal tunnel. Sometimes there is a phenomenon يعني الsporothrix may be invade tendon causing sporotrichoid tenosynovitis, which is look like carpal tunnel. You know carpal tunnel هاي الحالة طبعا شنو يصير inflamed of the nerve. Okay, tendon قصدي over nerve فالمنطقة تصير تحصل إلى surgery طبعا وانترفيرنج ويصير treatment. Okay, فالcarpal tunnel confused with sporotrichoid tenosynovitis. Of course, unless by diagnosis, by taking the microorganism and isolated, cultivated, we can discriminate this from that. So now we come to the therapy. How we can treat cutaneous lesions caused by sporothrix. Of course, iodide therapy is beneficial. Iodide, نجيب الايودايد ونمسح rubbing this area unless it's arise hematogeneously. Why? Because if it is arise hematogeneously, of course it needs systemic treatment because it's hematogeneously found. Okay, if it is comes from active infection يعني not hematogenous, جت من trauma injury, okay, we can treat it with iodide. With hematogenous, it needs another treatment. Therapy with other means is not satisfactory. But distal lesions may respond to emerging. The lesion, distal lesions اللي هي projecting spreading, okay, we can treat it by immersing the lesion in hot water for 20 to 30 minutes for 3 times a day. Okay, this is maybe beneficial for treatment. Sometimes we can need use heating pads. Pad هاي البطل اللي نسميه الحار، المي حار يخلون بيه، يعني أهلكم يمكن تعرفونها أو pocket warmers نسميها. We can put it on the infected area, maybe useful in some occasions. Occasionally, patients with only cutaneous sporticosis. Patients and the only cutaneous sporticosis without spreading to other organs may be improved by taking ketoconazole once daily. يعني هذا من نقول cutaneous بنقول only and that mean comes from hematogenous dissemination. This is maybe treated by ketoconazole orally or oral itraconazole for several months also maybe give good results. IV amphotericin B here works poorly and slowly making this toxic drug and expensive drug eradicated from treatment of such phenomena. Cutaneous, I mean tuberculosis. طبعا هنا من ketoconazole, itraconazole in case of particularly hematogenous dissemination. IV amphotericin B, although it is so strong, but it is poorly effective in cutaneous sporticosis. In case of sporticosis involving one lobe of lung, then with no contraindication to surgery, no contraindication to surgery, and no sporticosis elsewhere, we are probably best treatment by lobectomy. So lobectomy with or without IV amphotericin B, with or without IV amphotericin B. In osteoarticular sporticosis, surgical therapy has had a limited role. Here in osteoarticular, surgery have a limited role, but sometimes synovectomy maybe occasionally have an aid in, or give an aid to medical therapy. يشيل الممbrane اللي هي synovial fluid اللي surrounding the tissue. Synovectomy may be beneficial or useful in such phenomena. Prolonged therapy with IV amphotericin B has led to cure and perhaps half the reported cases of osteoarticular sporticosis. Prolonged therapy of IV amphotericin B may be beneficial in osteoarticular sporticosis. Sometimes we do combination. Fluocytosine, if you remember, we said fluocytosine is chemotherapy. With IV amphotericin B may be useful in refractory cases. What's the meaning of refractory cases? Cases in here resistant to treatment. We can use this combination. This combination is very good regimen of choice for resistant cases. Now, how we can diagnose the disease? Of course, we have direct examination, culture, direct examination. Here, gram stain or weight mount from past biopsy specimen, direct examination of such materials. I mean, gram stain. Sometimes we can use gram stain, but for example, for Candida, we can use it for Cryptococcus. But in case, because it's yeast, we can use gram. But here in Sporothrix, because if you remember, I said Sporothrix in the body, it's like a yeast, okay? Gram stain is not beneficial, okay? Sometimes periodic acid shift or Gomorrhe's methane amine silver stain are useful in such cases. I mean, for histology or histopathology depends, okay? Now, culture, here diagnosis depends on the isolation of the perfect isolation of the microorganism from the specific source of infection. Of course, here cultivation of the specimen from the skin lesion is either by drainage, depending on the site of lesion, cutaneous, swab, drainage, whatever. In case of course, sometimes skin biopsy, if it is subcutaneous skin biopsy, okay? Sometimes by skin biopsy, the subcutaneous cannot be open to the skin. How we can take the sample? By يسميها punch biopsy. شنو البانش biopsy؟ يعني ثاقب، ناخذ الثاقب البورر يسموه بورر، okay? 3 to 5 millimeter punch biopsy from the elevated indurated lesion. Okay, it suffices for the as biopsy for the diagnosis. The antemortem recovery of this agent from blood or bone marrow is in disseminated sporticosis is extremely rare. يعني before ما يموت البيشنت. Recovery of this microorganism from blood, it's not easy isolated from bone marrow or from blood. This microorganism not easy to isolate from this area. Isolation of Sporothrix schenkii are resistant, of Sporothrix schenkii. We can cultivate it on medial, for example, Sabros agar. We can incorporate antibiotic to the medial, cyclohexamide. Cyclohexamide, very effective antibiotic to eliminate the undesirable contaminant agents, okay? And the microorganism can be incubated at 25 to 50 degrees centigrade for a few days to up to 3 weeks. The incubation, sometimes if we incubate at 35 degrees, of course, it's preferred low temperature. Why? Because skin disease is the major disease caused by this microorganism. Therefore, it's preferred aeration, okay? But if we incubate the culture, the culture, yes, at 35 to 37 degrees centigrade, is slow down the growth, okay, or prevent the growth completely, okay. But there is a media referred to as blood glucose, blood glucose cysteine, BGC agar. This media, this is very important. We can use it for transferring the multiform to yeastiform, okay. Mold, you remember, we said it is dimorphic. When we cultivate it outside the body, it's multiform, of course. Inside the body, it's yeastiform. But in order to confirm the microorganism is Sporothrix or not, we can use this medial blood glucose cysteine to convert, of course, but here incubated at 37. Here it's need high temperature because yeast inside the body. Okay, yeast inside the body. Therefore, it's need high temperature. We can convert moldy form to yeasty form, and this is confirmative test for Sporotrix. These are different pictures. You will see it, inshallah, in my in the practical section. And you remember I said it's rose gardener disease, but at the same time it's look like rose. This microorganism is look like, I mean, Sporotrix is look like rose. Here you can see this section inside the body. Okay, this is blood, RBCs. This is macrophage, and full with, this is the nucleus of macrophage, full filled with the Sporotrix. Not filled with the Sporotrix yeast. Yeast. In the previous picture, you can see this is mold, hyphae, and the spores. Okay, this is here yeast. Okay, yeast either laying outside the macrophage, as you see here, or inside the macrophage because it's engulfed easily. This is a culture of the Sporotrix. Look like the colony look like this, and this is typical yeast within the tissue. Typical yeast of Sporotrix budding, nice budding. Okay. This is another picture. She will look like rose. Typical, look like rose. Okay, this is Sporotrix. Okay, this is lesion. This is culture. Another one. Okay, this is another picture of Sporotrix. Okay, this is nice. By lactophenol cut in blue. Look like rose, rose, rose. Very, very nice picture. Okay, that's all. Thank you very much, students. Any question, please? Nobody here?
ترى موجودين.
عشان اكو سؤال ما مالك شيء عندكم توضيح؟
شكرا دكتورة.
عفوا، موفقين ان شاء الله.
دكتورة عفوا سؤال.
إيه.
دكتورة.
قبل ما تبدا.
لا دكتور، بدي تسجل مو على المحاضرة. بالنسبة للبكتيريا كم محاضرة تقريبا بقيت؟ يعني هو كورس كله.
بكتيريا لو مايكولوجي.
يعني هو كله بصورة عامة.
كله؟
شو؟ اي لان شو؟
اي كمل شنو؟
السكجول يعني متخربط، مو بنفس التسلسل اللي دا ناخذ احنا بيه.
لا ايه هو صار خربطه، هو خطا من عندي. لان اكو وحده من المحاضرات الكانديدا والكريبتوكوكس صار اكو يعني صار فد كونفيوجن بيها، بس عدلتها، بس هي ديسين. يعني بعد لكم والله ما اعرف، يعني سكريبتو بعد عندكم ريكيتسيا وكلاميديا وهستو 1 2 3 4 5 6 7 8 9 محاضرات بعد لكم كولكتيفلي ميكس بين البكتيريا ويعني تقريبا 4 اسابيع هيك شيء يعني تقريبا. اوكي
شكرا دكتور. تمام.
لا موفقين. Okay.